Today, I'm reacting to Adriana Chechik's recent TwitchCon injury.
Oh my God!
Big sympathy, some sense of her own.
I'll explain how this jump left her with multiple broken vertebrae, what the follow-up surgeries entailed, and what she can expect moving forward. I just heard about this incident from the godfather of internet drama, Moist Critical.
Twitch streamer named Adriana Chechik was partaking in a fun booth at TwitchCon where you push each other off a pedestal into a foam pit.
As we saw in the footage, she wasn't even pushed. Compared to some of the things we've covered on this channel, this incident looks, at first glance, fairly underwhelming. But looks can be deceiving.
It was a foam kiddie pool. In fact, it wasn't even as deep as a kiddie pool. It was more like a foam flatbread, and it was just over cement.
Oh, well, that changes things. And thus, the innocent jump had devastating results. Adriana took to Twitter shortly after the injury to share more information. Well, I broke my back in 2 places, and I'm getting surgery to put a meter rod in for support today. Send your support. When it rains, it pours, and I am definitely feeling the rain right now. And she has remained active throughout the process, shedding light on the surgical procedures used and the recovery process. So surgery went well. 5 hours and 30 minutes. More fusions than expected. Bones completely crushed and nerve damage to my bladder. Hopefully I'll be able to pee again in the near future. No more squirting probably. Had some bleeding around the bone, but overall, doing good. 5.5 hours under the knife is a long time, and we'll talk about what the surgeons did and why it may have taken so long in a moment. But first, what other information can we glean from the event footage?
You good? Great victory there.
I can't get out.
Okay?
Immediately following the injury, she knows something is wrong, unable to move or stand, as the symptoms of a spinal fracture immediately begin to show themselves. Though it may vary depending on the severity and the exact location of the injury, symptoms include back or neck pain, numbness, tingling, muscle spasm, weakness, bowel and bladder changes, and paralysis, full or partial. Think about it. When a person suffers a minor injury or maybe tweaks something, they may actually be more expressive, rolling around in pain, slowly getting up and attempting to walk it off. But when something is really wrong, well, you're in shock. For every second she is quiet and frozen, I worry more and more.
She's held down by the pitbull medic.
Gravity.
No, she's fine.
Pro tip. If you are ever around someone who is experiencing some level of weakness or paralysis following a fall onto their tailbone or back, try not to pass off the situation as inconsequential. You cannot determine the severity of an injury by the absence of overt indicators. That is to say, screams for pain.
All right, we'll make sure she's okay. Get her out of the pit.
Landed on her tailbone.
Adriana is definitely feeling a sense of shock, although there is no indication at this point that she is suffering yet from a condition known as neurogenic shock. Neurogenic shock is caused by damage to the central nervous system, usually via a spinal cord injury, common in patients who suffer severe acute spinal trauma. This occurs when the descending tracts of the sympathetic nervous system are disrupted by a fracture or dislocation of vertebrae in the cervical or upper thoracic spine, and you lose fight or flight stimulation. The body's parasympathetic system, which usually acts in opposition to the fight or flight response, is now unopposed, and its rest and digest functions begin to take over, leading to vasodilation, decreased heart rate and low blood pressure, and possible loss of consciousness. A person experiencing the symptoms of neurogenic shock is definitely in danger, and certainly isn't theatrical about it. Adriana is lucky that someone with a trained medical eye was nearby. A special shout out to the random off-work EMT, who got workers of the booth to realize how bad I was injured, and to make them keep me still and calm me down until others got there. You really kept me from crying badly. Now, you may still be at home thinking, how can a fall from that height be so devastating, even if it is on concrete? Well, let's break down the situation. At the height of her jump, Adriana looks to be fairly high off the ground. What interests us is the distance of her tailbone to the concrete floor beneath her. A conservative estimate might fall between 7 to 10 feet. Research shows that serious spinal injury is most common in victims of falls from over 10 feet, but can occur at lesser heights. Sean Hughes, a professor of surgery at Imperial College in London, explains it doesn't take much of a fall to cause damage. From a height of 3 meters, roughly 10 feet, you could fracture your spine. Unfortunately, Adriana is dangerously close to this critical height. Now, in falls from a height, the first body part that hits the ground and the injuries resulting from the impact of the fall affect the morbidity and mortality of the patient. The head and cervical spine are the worst places to fall, but the rest of the spine is a close second. That's why Professor Hughes goes on to say that landing on your side might be the best way to survive a fall. You know, to keep the most vital structures out of harm's way. In Adriana's case, she fell in a slightly reclined position, with legs outstretched such that her tailbone is the first thing to make contact with the ground. If she had fallen in a more upright position, her buttocks and thighs might have absorbed some of the downward momentum, but as it stands, her coccyx and sacrum are virtually unprotected. These bones have very little tissue separating them from the ground, literally just the skin. And as a result, all of the force was transferred into her spine.
It was only 2 layers of foam blocks, basically, over cement.
And because the blocks are so few, it is possible for her falling body to act as a wedge, moving them out of the way. What's worse, the spine is designed to bear axial load from above or below with the vertebrae stacked vertically. It is less stable when the blow comes from an angle, as force is distributed unequally through the spine. In this case, instead of simple axial loading, there is also tangential loading occurring between adjacent vertebrae as well, which causes adjacent vertebrae to shear at an angle with respect to one another.
The spine and the discs hate shearing forces.
Are you starting to see why this is so bad? This is why people who work in places where falls happen take safety very seriously. At the very least, underneath a foam pit like this, there should be added padding to protect event participants from making direct contact with the ground. Critical directed viewers to a YouTuber named Josh Strife Hayes.
I used to work at a trampoline park. I know a thing or two about foam pit safety, because it was drilled into us from the start.
And obviously, this is for good reason.
Safety in those kind of things is paramount. Like, if someone gets injured, you shut stuff down and you work out why.
And from what I understand, this booth stayed open long enough for several others to be injured, which is absolutely mind-boggling.
Foam pits were at least 2 meters deep, so much foam in them they had springy floors underneath, wood underneath that would bend and break.
And when you jump, expecting that level of safety, you are more likely not to break your fall with your hands or twist your body in a way that protects your vital structures. At the moment Adriana lands, her arms are extended upwards in a celebratory manner, fully trusting the company behind the event to have taken such precautions. All right. So what do we know about Adriana's injury and her surgery? I was unable to find a report of exactly which vertebrae were broken, so we'll need to roll up our sleeves and hunt for clues in the information that is available to us. The most obvious hypothesis could be that Adriana shattered her coccyx or tailbone, which is where she made contact with the ground. But the coccyx is composed of 3, 4, most commonly, or 5 fused vertebral segments and is therefore more robust than other segments of the spine. And in 90% of cases, a broken or bruised tailbone can be treated non-operatively with physical therapy and special cushions. But as we know, she spent over 5 hours under the knife, and right off the bat, we have some information that refutes our shattered coccygeal vertebrae hypothesis. It may also be tempting to associate her difficulty peeing with a crushed tailbone, since the pelvic parasympathetic nerves, which originate there at levels S2 through S4 of the spinal cord in the sacrum, excite the bladder and relax the urethra in order to allow you to pee. This is not to be confused with the lumbar sympathetic nerves, which originate at the T10 to T12 level of the spinal cord that stop you from peeing via the opposite process. But again, this doesn't necessarily indicate coccygeal damage. If a vertebrae further up the spine has been shattered, this could easily impair the function of the spinal cord below. See, the spinal cord is about as thick as your thumb and is very delicate. It sits in a fluid-filled canal in your vertebral column and sends signals up and down from the brain to the body and vice versa. When vertebral segments are injured, the spinal cord can also be damaged or interrupted. For example, by a stray bone fragment or inflammation, and its ability to send signals back and forth is impaired. The result? bladder emptying problems. We must also consider the possibility that Adriana is suffering from a mild form of spinal shock, which is a condition commonly associated with the neurogenic shock, which we covered earlier on. Spinal shock is the flaccidity of muscles and loss of reflexes seen following spinal cord injury. And although in most cases it manifests as full paralysis below the level of injury, it can be more subtle. It is associated with an inability to retain urine or bowel contents. And although urinary incontinence may be present, bladder emptying is also dysfunctional, making some form of catheterization mandatory. So blessed to have left the hospital. I am lucky. We thought I might not be able to pee on my own with the nerve damage, but baby has been doing it for a day now. I'm so proud of my body and thankful for the love you're sending. It's helping so much. The fact that doctors thought she might not be able to pee on her own is consistent with this hypothesis, as spinal shock typically lasts days or weeks after spinal cord injury, with an average duration of between 4 to 12 weeks. But hold on. She's left the hospital and I haven't yet explained the surgery. Let's rewind for a moment. So the bones that are most likely to suffer fractures in accidental slips and falls are the lumbar vertebrae in your lower back, L1 to L5. While these are the largest vertebrae in your spine, they are very mobile. This is where your back articulates when you bend at the waist, while at the same time, they are the least supported by other structures. Let me explain. We've already seen that the coccygeal vertebrae are fused, making the tailbone into one piece. The coccyx is attached to the sacrum, a shield-shaped bony structure that is located at the base of the lumbar vertebrae and that is connected to the pelvis. Thus, there is a rigid, strong structure below the lumbar region. Above it lies the thoracic vertebrae, numbered T1 to T12, which are supported by the ribcage. The vertebrae here are able to articulate, but are somewhat more constrained than the lumbar segments below by the connected rib cage. So when a person falls, the sturdy coccyx transfers its force up into the nearest and most susceptible segments, the lumbar vertebrae. L4 and L5 are common sites of injury for several reasons. One, they are directly adjacent to the robust sacrum, which transfers the force of the impact upwards. Two, they are the lowest susceptible vertebral segments, and upon impact absorb the weight of the body above. And as a result, they suffer the highest concentration of force. Given her mechanism of injury and Adriana's description of the injury, she may have suffered a terrible burst fracture somewhere in the lumbar spine. This occurs when the compressive forces are sufficient to cause the vertebrae to break in compression, forcing bony pieces to move posteriorly into the spinal cord or other soft tissues. These are the hardest to repair and result in the most damage. This could have occurred in two adjacent vertebrae or in multiple non-adjacent vertebrae. For example, L1 and L5 at the top and the bottom of her lumbar spine. A compression fracture could also have occurred wherein blunt force or pressure caused the bone to break but did not send bone posteriorly into the spinal canal. Either way, you can't function with vertebrae that have burst or that have been crushed and comminuted fragments of bone irritating your spinal cord. Surgery number 2, going in now. Wish me luck. If multiple vertebrae were completely shattered, the doctors would need to perform several surgeries to reconstitute them and stabilize the spine. First, they would access the damaged vertebral bodies anteriorly via her abdomen to remove the crushed segments and insert an intervertebral fusion cage. This is a large hollow cylinder made of metal, usually titanium, that can be filled with bone graft to allow a spinal fusion to occur between two vertebrae. They would attach this cage to the vertebral bodies above and below with surgical hardware. This is a delicate procedure complicated by the intra-abdominal anterior approach and the presence of multiple comminuted fragments. You know, they're accessing her spine through her belly. No big deal. If you're wondering how the vertebral body can be removed without damaging the spinal cord, the answer is very carefully. Remember, the spinal cord runs through the spinal canal located anterior to the spinous process and between the lamina and pedicles towards the back of the body and the vertebral body in front. Adriana's vertebral body suffered the most damage. Okay, interns, with one surgery down, everyone can breathe a sigh of relief. Except Adriana. You'll need to wait a few days while your body recovers before surgeons are able to complete the second part of the procedure. I'm in a lot of pain, but feeling hopeful and ready to bring the heat to walk again. Anyone know where I can get my brace blinged and or pink coating for it, as I'll have to be in it for a long time. Thankfully, she seems to be approaching the recovery process with a sense of humor. That is until her first PT appointment. Tried sitting up today in PT. I would rather die than do that again. I hate this, my whole body hates it. I don't want to be tough. I don't want to be brave. I cried for an hour and the pain is so immense through all the meds I'm on. I don't know if I can do this. I can't explain this pain. Yes, some movement immediately upon waking up from surgery. In order to regain as much function as is possible, it is important to start the physiotherapy as soon as possible. This process can be painstaking and frustrating.
Wiggle your big toe. Hard part's over.
But the faster a patient gets moving after surgery, the less deconditioning there will be in the muscles, and the sooner the hospital staff will be able to identify the presence of any deficits or imbalances in the lower extremities. In addition, weight bearing soon after surgery stimulates bowel and bladder function, which often go on vacation following surgery like this. On the second day, we walk. After the first surgery, there is enough stability for her to stand and put minimal weight on the vertebrae, while a rigid brace, such as a TLSO or thoracolumbar sacral orthosis, provides supplemental support. She'll be wearing it anytime she is moving about for at least 3 months following surgery, while the vertebrae fuse with the cage. She will remove the brace for brief periods of time to shower and attend to personal hygiene, but will have to maintain her back in a neutral position and avoid bending. Surgery number 2. Going in now. Wish me luck. In the following surgery, the doctor will perform a posterior lumbar spinal fusion, entering through the back and further reinforcing their work from the previous session. When all is said and done, Adriana will be walking around with a fair amount of surgical hardware in her lumbar spine and in a world of pain. Who else has had back surgery? Why do I get an instant migraine when sitting up or walking, even braced? Is it the pain or what? I can only stay laying down to not feel my head's gonna explode. Her headaches were likely due to a cerebral spinal fluid leak that she mentioned several days after being discharged from the hospital. The spinal cord and CSF are surrounded by 3 layers of membranes, and a leak occurs when there is a hole or a tear in the outermost layer known as the dura mater, allowing fluid to escape. This can occur anywhere in the spinal column, and consistent with Adriana's tweet, the headaches are worse when sitting or standing up and subside when laying down. I do have a CSF leak, but we are hoping it'll get better with time as it's been a little less of a headache each day. However, guys, my ear and eye legit leak. It's nasty, but I'm pushing through. From here, if Adriana recovers as expected, she will be able to return to simple household activities and move without a brace after 3 months. It may take 6 months to a year for her back to heal completely. And even then, she will need to approach physically demanding activities with caution. This type of injury is undoubtedly a life-changing event, and it's unfortunate she suffered something so serious so early in her life.
Everything is, I'll grab it. Oh, you got it right there? Oh, all right, great.
I wish her the best of luck and commend her determination to recover. She will definitely need it on the long road ahead. If you liked the video, be sure to subscribe. And if you didn't, let me know why in the comment section down below. As always, that's been a word from Dr. Chris, Dr. Everyday Ortho, where we see one, do one, teach one.